In this fourth lecture in the course, we are going to take a first step into the field of economic evaluation. We are going to look at three basic types of economic evaluation. Those are CEA, CUA, and CBA. It is cost effectiveness analysis, cost utility analysis, and cost benefit analysis. We say that economic evaluation is the comparative analysis of alternative courses of action in terms of both their costs and consequences. So for a full economic evaluation, we need to compare at least two, but we can also have more alternatives. This is the comparative part of the definitions. We also have to consider the costs and to consider the consequences. All these three need to be fulfilled in order for it to be a full economic evaluation. But remember that the economic evaluation provides important information to the decision makers, but usually it does not cover all important aspects that are important. For example, the economic evaluation in itself do not answer the question, can it work? I mean, can the treatment that we are analyzing really work? Are there any side effects? What are the acceptance from the patients and so on? So the economic evaluation is only a part of a full evaluation in order to make wise decisions. So here is one way to look at it. We had the question of comparison. Do we have alternatives that we can compare, or do we only have one alternative? And the other dimension was, do we examine both cost and consequences, or are we only focusing on either costs or consequences? So we end up with four different types of analysis. One is where we have only one alternative and examines either costs or consequences. Then we have either just an outcome description or just a cost description. On the other hand, if we examine either cost or consequences but do compare between different alternatives, we can have an efficiency or effectiveness evaluation if we examine consequences, or a cost analysis if we consider the costs. If we examine both costs and consequences but only have one alternative, then we have a cost outcome description. And finally, if we examine both costs and consequences and compare different alternatives, then we have our three basic types of evaluation: the cost effectiveness analysis, the cost utility analysis, or the cost benefit analysis. So a lot of this course is going to focus on these three types of analysis. But first, in the next lecture, we're going to focus on cost analysis, because this is common for all the basic types of evaluation, that we consider the costs. So this is common for all three. But we measure the consequences different in the three types of evaluation. So the important difference between these three is how we measure consequences. In cost effectiveness analysis, we are interested in comparing how a specific measure of health change in analyzed programs. For example, it can be life years gained. So we can have a severe disease where we compare different treatments, and in all the different treatments the patients can live longer. So we gain life years from the treatment. We then also calculate the costs of the different treatments and set the cost in relation to the change in the health-related measure for all these alternative programs. And we then get, for example, cost per life year gained. Or it can be cost per pneumonia case avoided. And since we are then comparing different treatments or programs, we get an answer of which program that have the lowest cost per life year gained, for example. In cost utility analysis, we are interested in comparing how the utility change in the analyzed programs. So here we are not focusing in just one output of a specific health measure. Here we instead try to calculate some utility measure that are reflecting the preferences of individuals, preferences on a set of different health outcomes. Remember the question I had in the last slide in the previous lecture, where I asked you to choose what treatment you would prefer from two different symptoms of flu, the headache and the coughing. If we have cost efficiency analysis, it's hard to choose. How should we calculate the benefit when it's both the coughing and the headache that is getting better? In order for cost effectiveness analysis to work, we need to just have one output. But here, when we have cost utility analysis, we can have more changes in more than one health outcome. And then we try to have a utility measure that accounts for the change in the different health outcomes. So then we calculate the costs of the different treatments and set this cost in relation to the change in the utility from the different programs. One type of utility measure is the QALY, and another is the daily. We will get back to these later in the course, but examples of results from a cost utility analysis can be cost per QALY gained or cost per daily avoided. In cost benefit analysis, we try to value the benefits, that is, the consequences of a program. We try to value the most common way of valuing the benefits or the consequences is valuing them in terms of money. One way to do this is to conduct willingness to pay studies. We will come back to this later too in the course. So here we have an actual number. So we have calculated the benefits in terms of money. Then we calculate the costs of the program also in terms of money. So in this type of evaluation, we just can compare the benefits and the costs. And if the benefits exceeds the costs, then we have a net benefit. It's positive. If we have different programs, we compare different alternatives, then we can choose the one with the highest net benefit. If the cost exceeds the benefit, then we have a net loss. And then we should really question if we should implement this treatment. So this completes this lecture and also the introduction module in this course. In the next module, we will look deeper into the analysis of costs.